Hello, everyone. My name is Solomay Tibabu. I'm the host of the Going Digital Behavioral Health Tech Conference, and I'm very excited to have Dr. Cynthia Castro Sweet with us today, Senior Director of Clinical Research at Modern Health. Dr. Castro Sweet, so exciting to have you here with us. Can you share with the audience what is Modern Health?
Yeah, for sure. Thanks for having me, first of all. It's great to be here and be a part of this conference. So Modern Health is a comprehensive mental health platform for enterprises around the globe. We offer a really nice full suite of services and care for people along the full spectrum of mental health needs. And I think one of the great things about us that made me excited to join Modern Health was the fact that we are around the world and we're serving people on every continent. And mental health is not something that is preserved just to the US. It is a global issue and global challenges, as we know, what we've all experienced in this past year with COVID-19. So that's what we're here to do, is to change the conversation around mental health and help people get more access to the type of care that is best suited for them and is resource conscious and evidence-based and effective. And me and my research team at Modern Health are here to prove that that's what's happening and show the evidence of what we're doing.
Well, you've been in the thick of things for a while in this space. Can you talk about what are some of the major issues in mental health right now?
Yeah, so I'm a clinical psychologist by training, and I've been around for a little while on the earth, and I think one of the great things I've seen happen over the course of my career is we are finally starting to tackle a lot of the stigma and change the conversation around mental health. It is a part of our health. It's something that we all have, right? And I think there used to be a lot of fear and stigma around mental health because we all had this concept of mental illness. And I think what most people were thinking about was serious mental illness. And yes, that does exist, but it's really just a small percentage of the population. All of us struggle, all of us go through challenges, all of us kind of ebb and flow in how we're feeling, the health of our relationships, the health of our engagement in our work. And so I think we have a fuller appreciation for mental health now and a fuller understanding that it is a garden that needs to be cultivated, right? And needs care and needs to be tended to, much like our physical health conditions. So I think the challenge upon us now is, how do we develop care in a way that can be accessed and approachable by people who need it, and get it to them in a way that is more person-centered. I think some of our more traditional models of providing care, we think about therapy, and it's a little bit more rigid and more fixed. And now, thankfully, with the rise of digital tools, we're really able to unlock a lot of care for people and bring it to them in the context of their daily lives. And that's really where I think it could be most effective.
So, speaking of delivering mental health services, it seems like mental health solutions for employers has grown ever more popular. Can you talk a bit about what's different about Modern Health's approach?
Sure. It's true. There has been a greater demand, particularly in 2020, from employers wanting to meet the needs of their population. I think, where Modern Health really differentiates itself is the fact that we do serve the full spectrum of needs that are out there. I think, earlier on, you would see more kind of point solutions, or solutions that were really more therapy focused. And in some of the research we've done, we ask people about their preferences and tell them the types of care modalities that are available. It's not always therapy, and it's not always one-on-one, even though that's kind of the picture we have in our head of when we think about mental health and getting care for it. So we have research to show actually less than half of people who are contemplating mental health care do not really have a strong preference for one-on-one therapy and are open to other options, are open to the idea of doing self-directed care. And there's quite a bit of research showing that some very effective techniques and tools from psychotherapeutic approaches can be translated into other formats where they can be more self-guided, or they can be group-based, or it doesn't have to be providers at the top of their license. I think the rise of coaching is the thing that's worth considering, that coaches can be very effective in helping people learn these techniques and tools. And that's what we're seeing. We're seeing that we're getting good outcomes across the spectrum of needs, able to really give people the kinds of service that they want, that they prefer, and not kind of box people into getting care a certain kind of way that we think works for them. It's really, people, I think, know themselves better than we think they do, and what they prefer, we're finding, is a little bit more variety and different modalities, and we want to be able to provide that, and our platform really allows for that. So people can have access to self-directed care. They can have access to our circles, which is our group sessions. They can have access to coaches or to therapists. So it really depends on their needs, their preferences, what they're willing to work on, and what's the best way for them. And so we collect a lot of information from people at the beginning to really try to give them the personalized experience that we think is going to be most effective.
Oh, wow. So it sounds like it's not just about matchmaking for therapy. It sounds like you've got a lot of other modalities.
Most people think, when they think of mental health platforms, they think, oh, you must match people to therapists. And that's true. That's part of what we do, but that's just a piece of it. And like I said, not everybody actually wants that, and even more importantly, not everybody, I think, really needs it. Providers who are licensed therapists are a great part of the solution, but they're not the only solution. And from a resource standpoint and from an economic standpoint, if you think about the cost of mental health care, they're the most expensive option, but they're not the most necessary option if you think of the full spectrum of care. So you might be surprised when we ask people what they want to work on. Quite a number of people wanted to talk about and work on things like their personal growth and their financial health and their physical well-being. And when we ask them some questions that are more of a clinical nature, they don't have a lot of symptoms of distress or anxiety or depression. A certain percent of the population do, but not everybody does. But that other segment of the population that may not be experiencing symptoms, it doesn't mean they don't want mental health care. They actually do, but they want different things. And so we have good data showing, there's a lot of kinds of needs out there, and it's not always because people are, in a more acute stage of distress. That percent of the population does exist, but it's a smaller percentage, and we want to preserve the best resources for them. And that's where therapy can really be valuable, but it's not a broad solution for everything. So, let's get people the right kind of level of care, and in a resource conscious way that is still effective. So, I think, we talk quite a bit about mental health platforms thinking therapy, but it's much more complex and importantly, more nuanced than that these days.
So how does modern approach a variety of different backgrounds and acuity levels, other factors that play into the appropriate offering?
Yeah, so we use what's called a stepped care approach. This is an approach that comes out of healthcare, and it's really about tailoring the or planning the care pathway for people in a way that gives them the most effective care in the most resource sensitive way. So it's not a one size fits all solution, right? So what we do is we do some initial assessments of people. We ask them, what brought them to us, a little bit about their personal background, a little bit of demographic information. And then we ask them, what do they want to work on? And importantly, how do they want to work on it? What modalities make sense to them and are they open to? And then we look at all that information, and based on that, we can think about their current state of functioning, their current state of clinical acuity, as you said. Are they experiencing symptoms? If so, are they mild, moderate, severe? Is it more situation based, or has it been a more chronic concern for them? And so based on our understanding of people on that information that we collect from them, then we can really serve up a dynamic kind of care plan for them that really fits where they are right now and delivers it to them in the way that they want to work on their issues. So, again, this is where either the self-directed care or the group-based model or coaching or one-on-one with a licensed therapist, are the options available. And they don't just get one, right? It's not an option if you don't get a choice. So they can use multiple modalities. And we have seen, the more modalities people use, the more benefit they get. So it's really nice that we have a package that has lots of options for people, because you might need different tools and different modalities at different times. So it's really important to give people all the tools that they need and just help support them along the way as they learn how to use them.
Now let's talk a little bit about clinical outcomes. How is modern health tracking clinical outcomes? What's your approach?
Yeah, so clinical outcomes are really important and also a challenge in the mental health field, because it is a subjective experience, right? It's not something you can do a biological test to get a value, right? So there's always a bit of sensitivity around doing an appropriate enough assessment that you get a good clinical understanding of people without over-indexing on asking people too many questions and burdening them with that, and also having that interfere with their ability to access care, right? If you think about, every time you come into an app, you don't want to have to answer a bunch of questions before you get what you need. You're there for a reason. So we try to strike a really delicate balance of asking enough questions to give us a starting point, and then repeating those measurements along the way to really give us mileposts and to think about, are we seeing progress? How does their progress map to the amount of care that they're getting, or how well they're engaging with the care? So we use a few common clinical metrics, the WHO-5 being the most important one. And we use that because we are global, right? So it's important to have assessments that are not unique to a certain population and that have validity and reliability for a broad number of users. So we use the WHO-5 as a general screener, mainly for depression symptoms. Depending on how people score on that, we may follow up with additional questions about depression or anxiety. And so that's kind of some of the information we collect from their experience on the platform. What I'm really excited about, though, from a research angle, is I have the ability to do very specific studies around really important focus areas that maybe are not things we want to ask every user, every member about every time. But periodically, we might want to ask them so we can see how we're doing with resilience, right? And conduct some specific studies around that, because there is a field of research around resilience alone, or people's coping skills, or their relationship well-being. So, there's lots of things that we could evaluate. We do have to be conscious and not over-index on asking too many things and having too many outcomes, but reporting on the essential outcomes that matter, which is, are people improving? Is their general well-being improving? And then as we get more experience and learn more about all the different kind of possible outcomes we could be getting, just being really thoughtful about those additional metrics that we want to be tracking. And I think what can be exciting is our ability to try to integrate additional information in partnership with some of the customers that we work with and other entities to try to tap into other sources of data. So I think a big outcome of interest always to employers particularly is people's work life. So are people being productive? Are they at work but not really, probably shouldn't be there? Are they needing a lot of sick leave because they're not doing well and are struggling? Those are really important outcomes. Sure, we could ask people a ton of questions about that, but human resources departments and employers also have that information and track that information in more passive ways. And I look forward to the time when we can integrate some of that information so that we can learn a lot about the people that we're serving without having to burden them with additional responsibility of telling us, how they're improving. We can collect that information in other ways, but it's a little bit more complex to try to jump through the hoops to get that data, but there's definitely pathways to do that.
Let's talk a little bit about providers. What's your approach to high quality care delivery and the providers on your team?
Mhm. Yeah, that's a great question. It is an ongoing process. So it starts with sourcing the providers and then supporting them and then constantly evaluating how we're doing and how they're doing with the members that they're serving. So, we put in quite a bit of work, and we have a great team of clinicians who are really thoughtful in their approach to determining, what's the right qualities and features to look for in our provider network. And imagine this is on a global scale, right? Because we're serving people in many countries. So we do a fair amount of assessment and evaluation of providers during the hiring process or the sourcing process to understand their experience level, their training and background, their comfort level, and working in different areas, because not every coach and not every therapist is actually, specialized across all areas of mental well-being. Some may specialize in relationships. Others may specialize more in people with more clinically severe symptoms of depression, and that's what they're really good at. So we want to learn about them and their clinical acumen. And then we also look at their level of use of evidence-based therapies, because that's really important to us. We really want people to use only those therapeutic techniques that have been proven to work and give people the skills that they need. So we do that kind of evaluation, and then they get a ton of support when they're working with us. So we have a full team and great directors of clinical care who are supporting our coaches and our therapists, doing trainings, are available for case consultations and supervision and ongoing training. And then we do pretty thorough evaluations, not just of the delivery, the metrics of the care, but we want to hear from the members that are working with them. How satisfied are they with the care that they're getting? What sort of therapeutic alliance? That's a really important component. The more someone feels really bonded and working well with their provider is a great predictor of outcomes. So we want a strong alliance. So we look at those kinds of metrics from the member level, and then we want to make sure we have content, happy providers, right? Because they're people too, and they want to be satisfied and happy and fulfilled in their work. So we're also mindful of their experience working for Modern Health and make sure that they feel supported, properly resourced, challenged, but not overtaxed in the work that they're being asked to do. So they feel like they're, getting a fulfilling experience with us. So it's a full kind of 360 approach.
So you're newer to Modern Health, as I understand it, but you've been in this space for a while. What do you think is really evolved in the behavioral health tech landscape?
Yeah. So I'm a few weeks into Modern Health, but it's been a really smooth transition. And I think part of that is because I am a clinical psychologist, and these are my people, right, that have built this product and are working to build the clinical team. So I'm really comfortable with the work that we're doing here. What I think is really interesting and exciting that's going on in the space of behavioral health is we're moving beyond certain point solutions, right? That we're really more focused on therapy matching. Again, important part of the equation, but not the only solution. So we're moving beyond that and thinking about people for the more complex and holistic beings that we are, and thinking about all the needs and interests and challenges that we need to work on and want help with. So that's an important piece. So I think another interesting thing that we're starting to see in the broader field in behavioral health is the application of digital tools to conditions that we used to think were, only could be done face to face or only could be done in a more supervised model. So I've been seeing the rise of companies like Equip that's working in eating disorders, and I've seen some work in family therapy. So things that seem more kind of logistically challenging and complicated, and also are really pushing the envelope on what digital delivery can do. So I think it's exciting. It's a little scary at the same time, right? Because these are, very delicate situations and scenarios. There are ways to handle it, safely and appropriately, but it does take a delicate approach. So I think it's an exciting time. There's a lot going on, and at the same time, I think I don't envy the employers that have to make these choices, right? There's a lot out there. I think it can be hard to differentiate some of the products that may be more focused on, stress reduction and mindfulness. Those are important, but again, those are just part of the solution. And then there's others that are really focused on, we can get you connected to a therapist. Great, but there's a lot of stuff in between, right? And so the more you can provide a more comprehensive model that adds more dynamic offerings to people, you're going to have a better experience for your population because you'll be able to meet more people's needs with fewer decisions.
So, Dr. Castro Sweet, it sounds like Modern Health has become a pretty comprehensive platform. Is there still more room to grow, or what's next?
Yeah, for sure there is. And I think a great example is the addition of our circles. So that is our group-based forum that we've built in the past year. And that's our foray into more group-based therapeutic sessions for our members. It's an additional offering, so people can use just the groups. They can use the groups plus other things. Again, we want to give people choice and access. But it really has added a nice element, and it's something that we study, right? So it was a piece that we didn't have before and that we added. And I think, COVID-19 was a bit of a forcing function, right? We were all feeling more isolated and less connected and needing more support, but more social connection was really not in the cards for us last year. But adding these online groups was a way of helping connect people to other people with similar interests and needs and desire to be around, like peers. But it's also a piece we needed to study and determine is this adding value, or is it does it just feel good, but is it really helping people? And what we found that, we looked at the preferences of people, and there are people who do prefer the group format on an online setting. I think it can be great for the introverts like me who you need a little bit of social stuff, but you also need a little bit of distance, right? And it gives you a little bit of those things that you want. And we're evaluating it now to look at how it has been a springboard into other care modalities for people. And it speaks to what I was talking about before. If you give people the kind of care that fits their preferences, it really opens up other possibilities. And I think it's true, especially for people who may have been more reticent to getting care because they're thinking, oh, it's therapy and, I don't need therapy. But, we can all improve something. We can all build new skills and things like that. So I think it's going to be great to see how this group experience has brought in people who might not have otherwise engaged, and what doors it might have opened for them, right? And help them be more accepting and willing to try and experiment with other modes of care. And that's a guiding philosophy that we're going to take with us in the future. There's other pieces to the platform that we could add. It's always going to be a bit of a balance of demand. What are people looking for that we're not currently giving them? We've taken a different approach with our coaching, where we now have a kind of different categories of coaches that are more mentally health focused and have more advanced training and expertise in mental health. So no, they're not doing therapy. They're not doing the work of licensed clinicians, but they're working with people who may have mild symptoms, or maybe going through some more situational stressors that they can use more support from. And they're coaches that are more comfortable and familiar with working with people with more, clinical needs. So, just within the world of coaching alone, we're starting to see a need to expand what we're offering and think about different coaches for different reasons. And then, the sky's the limit with other kinds of things we could add, not just even modalities, but also more populations we could be serving. I'm really intrigued about the idea of dyads and families being able to get access to care in ways that are, best suited for them. Different global parts of the population. We're not in every country, but we're in a lot. But there's always, there's always more out there. But we got to tackle a lot of the challenges of getting providers, and what providers look like in every country has been really fascinating to understand what the provider ecosystem looks like around the world. So there's a lot of room for growth, a lot more clinical areas, I think, that we may want to tackle, but again, we've got to do it pretty thoughtfully and make sure that it's something we can do effectively, and be sensitive to it making sense with how we deliver our care and meet the needs of our population, and keep studying it and keep looking at the outcomes to make sure that we're adding value every step of the way.
Well, it certainly sounds like you're being very thoughtful about different offerings, offering the right solution at the right time and place per individual. But do you have any advice for the employers out there that are trying to figure out how to navigate stigma?
Mm-hmm. Yeah, that's a great question, and I think it's a really important struggle or challenge for employers to think about changing the conversation around the workplace about mental health. I think it's something that people worry that they're going to get wrong if they try, right? So we can give them some strategies and some suggestions and solutions. And research does show that if you help to elevate mental health literacy and improve people's knowledge and understanding about mental health, that serves as a conduit to people being more receptive to care. And so that's an initiative I think that is really important to work on with employers, is to think about how can you provide content or leadership or role models about talking about the value and importance of mental health, educating people about it, normalizing it, normalizing the fact that we all have mental health and we're all somewhere on the spectrum of healthy to not doing well at different times of our lives and different days of the year. So I think the more we can just talk about it and have it be an open discussion and have people know that they're not alone, or have a place to get their questions answered and to get more information in a way that they don't feel uncomfortable asking, really can elevate the literacy around mental health, and that will start to lead the way to people being more curious about what's out there and what might be right for them. And I think we recently did a look at preference patterns, and we saw more preference among men and more preference among older employees, so over the age of 45, so not old, but older relative to people in their 20s and 30s, had a stronger preference for self-guided care, more so than younger people, more so than females. And so what that says to me is you really need to offer the whole suite of modalities to people, because you never know. People know for themselves what they're willing to try. And so if you make those self-guided options, those kind of self-help options available to people, where they can access it privately and they can kind of put themselves through it at their own pace, you're going to open up solutions to segments of the population that you might not have otherwise provided the best kind of solution for previously.
That's so great. Empowering them by giving them the tools, but of course they'll select what's right for them.
Exactly.
Well, I've probably time for just one more question. Dr. Castro Sweet, if you could say what's in store for the future of modern health or even behavioral health in general, what would that be?
Yeah. So, looking ahead, I think we're only going to grow, both in our product offering and in our reach around the globe. I think that, with longevity of a company comes a higher bar that you need to clear in terms of your value. So one of the things I'm interested in long term for us and for the field of behavioral health is, what is the long-term benefit and value of this now that there's more receptivity to modern health or to mental health digital solutions, now that there's more comfort around having conversations around mental health, at a population level, what are we going to look like 5 years from now? Are we going to still be tracking kind of the same percentages in terms of people with conditions that are going untreated, or are we finally going to start to close that gap and connect more people to more care? So I know that's, definitely something we want to be able to do, is to close that gap in service and provide resources and access to care in the ways that people most want it, and still prove that it is effective and helps people feel better and feel more optimal. And I hope our conversation as a field will also kind of widen at the same time, because I think we often have a tendency to focus on, the more negative end of the spectrum and alleviating symptoms and taking away the pain and things like that. But there's a whole space about wellness and well-being that I think we're just starting to really appreciate. Our mental health and wellness isn't just about the absence of symptoms, but we don't have a great vocabulary yet, I think, to talk about that, because we've just been a little bit skewed in our focus. So I like to think as we're getting better and improving and kind of thinking more broadly, we'll have different conversations around mental wellness, and then start to think about, prevention and all of these things that we, how do we preserve people's functioning? How do we optimize people's functioning and take a more positive spin on our mental health? So we're not just talking about the things that hurt.
Really great advice. And thank you so much, Dr. Castro Sweet. This was excellent. Really exciting to hear about this next chapter for you and modern health, for that matter.
Yeah, me too. Stay tuned, and thanks for having us.